So your blood pressure is a little high. Oxygen level is good, okay? So we're just gonna let you rest here for a little bit longer.
What you saw today from a sim perspective was a case that involved a patient that had a coronary artery bypass graft and a mitral valve replacement.
With all that's going on in here, you have different monitors going off. You know, your professors are watching you.
Bells, buzzers, all kinds of lights going off. The patients that are in front of them are responding. And so the students are actually having to practice hands-on and immediate response.
It really gets you on your feet and puts you on your toes as you would be out in the clinic.
Our goal for that case was to get the patient seated edge of bed and, if possible, stand and potentially transfer to a bedside chair. However, in the course of all that, I was able to manipulate vital sign responses as they transitioned from being supine to seated edge of bed to possibly stand. And then an instructor was even in the background holding up signs telling the patient to either complain of chest pain, complain of dizziness, complain of fatigue, and that caused the students to go to other forms that they have that would actually allow them to document dyspnea, angina, or ratings of perceived exertion. And based on the patient's report, the student had to appropriately respond.
You know, the last thing we want is to sit our patient up or stand them up and, you know, their blood pressure is dropping, they're starting to feel dizzy, they're starting to feel lightheaded.
It is a simulated situation that they are going to have to face when they get out, and it may actually give them an opportunity to deal with things they never thought of before. And it gives them a chance to think through it before it is actually a real-life experience.
We've been trained under it for so long that it gets us prepared for any situation that we could be put under.